Hi, let's see Latissimus Dorsi muscle flap skin marking. Few anatomical aspects of the Latissimus Dorsi muscle flap. It gets origin from the lower six spinous process of thoracic vertebra, lumbar fascia, iliac crest and interdigitation with the external oblique muscle and lower 3 to 4 ribs and scapula. That is the inferior angle of the scapula. And get inserted into the floor of bicipital groove. And its primary blood supply is from thoracodorsal artery and secondary blood supply is from lumbar and lower intercostal perforators, which is supplying the flap as it is a type 5 muscle, that is based on Matheson high classification, as it is getting supply from the axillary artery, that is the third part of axillary artery, which is branched into subscapular artery, which is again branched into circumflex and thoracodorsal artery, and thoracodorsal artery branches out to supply latissimus dorsi muscle and serratus anterior muscle. The bony landmarks like the spinous process of thoracic vertebra has been marked, and it's a T1 spinous process and T12 spinous process, and the iliac crest has been marked and the lumbar fascia is marked and lower 3 ribs has been marked. And now the scapula has been marked, and it's a outline of the scapula. And the proximal part of the humerus has been marked. As I said prior, it's get origin from the angle of scapula, lower 6 spinous process of thoracic vertebra and lower 3 to 4 ribs and iliac crest and lumbar fascia, and few interdigitation with the external oblique muscle, and get inserted into the bicipital groove. And now we are marking the axillary artery. From the third part of axillary artery, the subscapular artery get originated, around 3 to 5 centimeter from the origin point. There will be a circumflex and thoracodorsal artery, and thoracodorsal artery descends down and gives transverse and descending branch, and which will be 3 to 4 centimeter from the upper border of the latissimus dorsi muscle, which will be underneath the muscle, and 2 to 3 centimeter medially from the lateral border of the latissimus dorsi muscle. The pedicle length will be 8 to 9 centimeter. And approximately 3 to 5 centimeter from the axillary artery, circumflex scapular artery will get branched out. As it is a type 5 muscle, it also gets supplied from the lower intercostal perforator arteries and from perforators from the gluteus maximus and lumbar perforators. And based upon the lower intercostal artery and lumbar perforators, the flap can also be raised. And a lazy S incision is made to raise the flap, which is placed over the mid of the flap. And this is the pattern, and this is the arc of rotation of the LD flap which we have raised.
Like, comment and press the bell icon and subscribe our channel for better number of operative videos in plastic and aesthetic surgery. Thanks for watching.